Welcome back, everybody, to Leading Experts. I'm Grayson Foster. These days, we all know how important it is to have a beautiful and healthy smile. And my guest today, Dr. Hugh Oser, has a passion for cosmetic and general dentistry. After receiving his Doctor of Dental Surgery degree from Louisiana State University, he served as an officer in the United States Air Force, performing general dentistry. He has been in private practice for the past 30 years and is one of the only 5 dentists in Dallas to receive his master's in the Academy of General Dentistry. Dr. Oser, let's talk a little bit about CEREC one-day crowns that you offer to your patients. This is amazing technology, and it prevents your patients from having to come back a second time and go through needles and all of that stuff, right?
Definitely.
Okay.
Well, it's almost like being able to have 3 little short half-hour visits in one. It's each visit for, saying, restoring a tooth with a CEREC crown or an online. It's difference there.
Okay.
I'll tell you about that in a little bit, but it's about an hour and a half. Okay. And so I tell all my patients that the first half hour, I prepare the tooth so that it's ready for that restoration.
Okay.
And then they get the rest for the next half hour.
Nice.
And then during that next half hour, I'm designing it and milling the actual ceramic crown or online. And then after it's all made, then it's just another half hour to bond it in place.
Okay.
And then it saves the patient coming back and wearing a temporary for 2 or 3 weeks, which always comes off.
Right.
And it's just, it's been another wow factor in our practice. Our patients just go, wow, I am just so glad, you know, this is available now.
Exactly.
Because most of the patients over, say, the last 10, 20 years were used to having to visit crowns.
Right. How do you know if you need a crown? And do they only go on the back of the teeth, or can you use them on the front of the teeth? How do you know?
Well, it's very a technical thing that that everybody in the dental profession, they determine through an examination and x-rays.
Okay.
And what determines that is how much of the natural tooth isn't broken down or decayed.
Okay.
And so if the goal of every dentist now, and certainly mine, is to preserve as much of the natural tooth as possible. And that's what the CEREC restoration, all ceramic porcelains restorations let me do.
Okay.
So if the tooth isn't completely broken down in a 360-degree thing, we can save portions of it, and that's called an online.
Okay.
So it's just dentalese, but and my patients just say, well, it's just like a crown then, and it is to them.
Yeah.
So, but in any event, it's we can restore the tooth with an all ceramic material that is just like your enamel, and it's not only 100% restoring your tooth back to its original strength like it was before it ever had a cavity or any kind of filling, but an extra 3%.
Okay.
So it's 103% stronger with that type of restorations, and so everybody has a good feeling knowing that it's going to be very durable,
Okay.
long lasting.
We've talked about veneers and lumineers and certainly crowns. What do you do for your patients that are actually missing teeth? What do you do to build up their mouth before they can get to that cosmetic?
Yeah. Well,
makeover?
what we do is we let them know there are 3 options.
Okay.
And their 3 options are to replace the missing teeth either with removable bridge work, fixed bridge work, or implants.
Okay.
And because more of my patients are becoming aware of implants, they're asking more questions about that, and they're finding out that how it benefits them much more than the other solutions we had in the past of removable and fixed bridge work.
Right.
And so the beauty of it is it's so much more natural feeling, and it's much more like your natural tooth. It takes 3 stages, and the first stage is to place the implant and then let it osteointegrate in the bone over the next 6 months. Then the next stage after that is to place a post into the implant that allows you then to put a crown on top of it. So it's those 3 stages, and that's it in a nutshell.
Right.
With the implants.
And then once that person has their new tooth back, it's just like having, you know, what was there already. You can eat and do everything you want, right?
Yes.
Let's talk about the importance of replacing missing teeth, because a friend of mine, you know, in his early 30s, lost teeth and didn't bother kind of going to the dentist and dealing with that issue of replacing the teeth, but by the time he got around to doing that, there's already been bone structure that's lost, and like a third of his face had been, you know, shifted and moved. Talk about that, how critical it really is to replace those missing teeth.
Yeah, in talking about like preventive dentistry, sometimes for whatever reason, some patients have lost one or more teeth.
Right.
And when they do, after just within the first 6 months, the way the body tries to heal after losing a tooth is that it goes through a repair process, and what happens is your actual jaw shrinks. So it is leaving you with very little foundation, and sometimes you can't have that option of a dental implant if you lose too much of your bone through that repair process, and which is a shrinkage process. So lots of times we can prevent that. If someone still has to lose a tooth, we can place a bone graft there that allows the body to actually regenerate bone. And then you have a good foundation for the implants.
And how long does the implant process generally take from beginning to end?
Yeah, generally it's a 6-month process.
Okay.
Because once we know we have a good foundation, the implants in place, it just takes 6 months for that osseointegration. That's the process. That's the term that's given, where the implant becomes like your natural tooth was. It bonds with your upper or lower jaw, and then you can restore it, and it can function like your natural tooth.
Right. Also, in terms of replacing missing teeth, if you don't have all of your teeth, you're not going to be able to chew your food properly. That can set you up for a whole host of other health issues as well, right? I
just had a gentleman who came in, and he said, you know, his dad, he just had to bring his dad into a nursing home, had Alzheimer's, and he says he didn't have the advantages of preventive dentistry when he was growing up.
Right.
Lost all his teeth, had to have dentures, is miserable with his dentures, so much so that he takes them out all the time and he forgets where he puts them.
Oh, yeah.
And he loses them. And then he's really in a bind because he cannot eat.
Right.
And so they are having problems with that sort of issue, and he said, God, is there anything, you know, possible that we can help my dad out with? And I said, well, there is. Because of implants, we can give him back his almost like he was before, with natural feeling teeth, and not have to take them in and out.
Amazing. Dr. Oser, we're going to take another break. Stay with us as my conversation with Dr. Hugh Oser continues right after this.
Be the best you can be. A magnificent smile in 1 hour, and it lasts for years. Now that's value. Brightening smiles to brighten lives is the unique and only purpose of this company. Bright Smile, the professionals.
Oh, wow. Those look great.
Time to sparkle. Time for your brightest smile in just 1 hour with Bright Smile.
That's amazing.
Wow. It's painless, it's fast, it's easy.
If you're serious about your smile, you owe it to yourself to make one call to Bright Smile now and learn why Bright Smile may be the best investment you can make in yourself.
No more yellow.
It's worth it. It is the best.
Oh, wow.
Ooh, yeah. Call today for free information on how to get your brightest smile with Bright Smile.
We're proud of what we do, and we think you'll be impressed by your magnificent smile. Call Bright Smile now. We guarantee you it's worth one call before you invest even a penny in any other whitening product. We won't let you down.